and probably answer some or most of your questions. Dr. Sandeep.
Yeah, thank you, Dr. Reggie. What I'm going to talk about the recipe to distress is few basic simple things which possibly most of you will be doing it, but I'll just like to reiterate that these are the small things which can actually help all of us in fighting this stress during the COVID period. So the first and foremost important thing is we should all learn to take care of ourselves. Like we always go in flights and we hear about that putting the oxygen mask before you start helping others. So as doctors, we first need to learn that we need to take care of ourselves, and that is both our mental health and physical health, and rather than ignoring the mental and the physical health. Next important thing is, if we are not on regular duty, it's very important that you maintain a daily routine. Keep yourself busy with whatever hobbies you have, whatever things which you can do, so that you are occupied and you don't feel that you are not doing anything. And always express gratitude to things which are happening good around you. Maybe writing something every day, focusing on your positive thoughts, meditating, praying, mindfulness activities may help you. Ensure that you are taking a good sleep, no substance to be taken. Follow a routine where you are following some amount of exercise. Take healthy diet, and always when you're using screen media, try to control that you're not watching too much of screen, either in the mobile or the TV, so that you at one level are able to control that it does not go into the excessive part, and then you develop some kind of addiction to the same. Always take small media breaks. There's no need to follow the update, as Dr. Kalyan Sundaram said, that it's not a 2020 match that you need to watch the whole commentary. You leave it there. Learn to relax and focus on your positive thinking. Then, although we are talking about social distancing, but please remember that we should not be doing an emotional distancing. It is a misnomer. So we should be emotionally connected to each other, maybe by video call or whatever you can do, and try to support your family members, friends, peers, colleagues with whatever way you can do by connecting with them, and always take care of the elderly who are around at home. If you have any kind of physical illness, you're taking any medication, please continue that. Okay. The other important thing is, try to be a hero, but don't try to do heroic things. Something like that. Don't try to go and start seeing patients without proper equipments. These may be heroic acts, but you may end up torturing yourself or putting yourself in an unsafe situation. And if it is not safe to do practice, it is better that you sit back at home and relax, rather than going and exposing yourself and then later on maybe ending up in a quarantine or your hospital getting closed. Then one of the major issues which has been discussed is the finance. I think most important thing, we need to understand that we should stop worrying about finances. For most of the doctors, they can sustain for a few months, whether we agree or not, but this fact remains true to a large extent. For the government doctors, there's some salary cut, but still they can survive. And we need to change our perspective when it comes to money. That usually the people are normal Indian tendency that if I'm spending any money from my savings, it is considered as a loss. I think we need to understand that fact needs to go away, that if you're spending from your pocket, there is nothing to worry, because you're still gaining something, which I'll be discussing in the next slide. And cut down on your expenditures, support your peers, staff, colleagues who are requiring financial help. So when we look at the balance, maybe in the COVID times, we have so much of loss of income in the monetary terms. But what we have got, for which no money can be accounted for, you cannot put a value to that you have time for self, time for your family. You're having an unpaid vacation at home, or you can say, unpaid means you're not spending extra to get the vacation. You have a time to complete your pending jobs and time to rethink and replan earlier when you were so busy that you were not able to think clearly and plan your life. Always look at the positive side of the whole thing, that you have not developed the infection yet. You have survived the pandemic. Your family has survived. That's a very big thing. If any one of us gets ill, we all know what all consequences it can lead to. Then when it comes to talking to your staff and your colleagues about the finances issues, if you are not able to afford, not able to fund, so-called provide them the salary, I think it's better to have one-to-one meeting or the group meeting and discuss with them about the prevailing situation. Seek their suggestion rather than passing your orders, and ask their opinion about how all of us can stand together at this hour of crisis. Salary cut should be the last option. and it should be totally discussed before that kind of thing is done. And it should not be a unilateral decision. Termination of jobs is not a good thing to be done at this time, and try to be generous at this hour of crisis. Then when you're talking to your staff, other issues is protect them from stress, provide them a proper equipment. And when you're putting teams to work, always remember to combine inexperienced people and with the experienced people, because the supervision is not there. And always try to rotate your staff between the high risk and the low risk or the low stress functions, and ensure good quality communication and accurate information for your staff so that they are updated and they can change the upcoming guidelines every time they can implement at your workplace. And we all need to learn to support each other and recognize the mental health issues among your colleagues and fellow colleagues. And when it comes to talking to the families and the patient, again, it's very important, because we are seeing a lot of doctor violence against doctors. To inform them clearly about the change scenario, what you'll be doing and what you'll not be doing. Put clear information about the cost involved, that some cost would be escalated because of the PPEs and other things. And maintain social distancing in the waiting area, schedule appointments for people. And people those are working as faculty in the different institutes, they can emphasize with the administration to be very sensitive to the needs of the resident. They should be given freedom to express themselves. They should be provided adequate PPEs, and we should prepare them for self-isolation, quarantine, so that when they are sent to these places, suppose they are after doing the COVID duties, they are able to cope there. And we need to try to address their genuine issues. And at this moment of crisis, we should avoid all kind of interpersonal issues, because we are fighting an enemy. We don't know how it is going to affect all of us. And encourage people to stay connected, avoid overworking people, motivate your workforce, and have a cohesive approach. Discuss about the change scenarios with your residents and other training issues like surgeries, thesis, exam. And at institute level, you can develop SOPs for the training and research. And we have to be considerate, be available for support, and adopt problem-solving strategies to take care of your residents. Trainees who are working in the emergency, we need to, again, I just need to emphasize that partner inexperienced and experienced people, so that it's not just the first year trainee who goes to the emergency and others are not there, he or she is exposed. And be available for teleconsultation, and be a lead. For example, if a resident requires you in emergency, be prepared to walk there rather than getting scared, because more you act as a role model, it will be good for them. And if somebody says that he or she is not mentally or physically fit to do COVID duties or emergency duties, at this moment we need to be considerate. We should encourage them to self-disclose their mental health issues and respect this disclosure and help them in coming out of this situation. And those who are at the leader or the administrative position, they need to learn that at this moment, working like a boss is not going to help. But what is going to help is you have to work like a leader who has very clear communication, works like by giving himself as an example. He is an inspiration for others to follow. He does the work and he thinks about the team rather than about self. That is what we need to understand. Everybody needs to do. And we all have to prepare for a long battle, because the COVID-19 is going to stay for some time, and we need to get used to the new normal and plan ahead. Then how to recognize depression in your colleagues, because that's something which all of you need to now understand. Somebody who complains about some physical symptoms of aches and pains, or he's socially withdrawn, or reports about some suicidal ideation or low, or he's reporting about some amount of irritability, he becomes tearfulness. These are certain signs and symptoms which should make you suspect the person may be having depression. So if you want, without understanding the signs and symptoms, if there's sudden change in the behavior of a person, he starts staying alone, avoids interaction, refuses to come to parties, movies, classes, that can apply normally. But in this hour, if somebody stop responding to phone calls like usual, gets angry on the small issues, get tearful on the small issue, reports about a lot of fear, lethargy, weakness, lethargy, I think we need to understand that we are possibly seeing a person who may be having depression. And these kind of answers from your residents or your colleagues, I'm fine, I'm just tired, I already had my food, go away, I'm just cold, I'm better, I promise, I'm okay. These all are actually conveying a very different meaning. I am fine basically conveys I am not fine, please help me. That is the message which you need to learn to imbibe. And what we should be doing, we should be trying to be very supportive to them. We don't try to diagnose them by ourselves. Don't try to don't try to tell them that they can just snap out and come out of the depression if somebody has a syndromal depression. And we should encourage them for professional help, organize a professional help for them, and advise them, encourage them to take medical treatment so that they can come out with all of kind of psychotherapeutic and the medication treatment. Then you should not be arguing about bad things with people those are going through depression, and don't insist with people who have depression that it's a wrong feeling to be that you are experiencing. Don't become angry even though your efforts are failing. You have to do it again and again, and always emphasize that depression is treatable. And what we need to understand that just being there for someone can sometimes bring hope and what all seems to be hopeless. And rather than and avoid saying things like you are weak, faker, loser, or you are not worthy. These are certain things which often the junior staff will often hear from the senior people, and that again demoralizes them more than anything else. These are certain things which you should be avoiding to tell your colleagues who are going through depression. By your own notion, it is better that leave that to the professionals. And what a person himself can do if he or she is going through depression, talk to someone whom you trust about your feeling, keep up with the activities that you normally enjoyed, and keep contact with your family and friends, have regular sleeping and eating habit, and exercise regularly, avoid any kind of substance, and improve your thinking and stop dwelling on the negative thoughts. And always seek professional help. Remember that the right help can get you better. And if you feel suicidal, contact someone for help immediately. And we all need to know that how we can prevent depression is that we minimize our stress and maintain a regular routine and have good social support. And why people usually don't seek treatment for depression, as Dr. Kalyan Sundaram rightly pointed out, that there's a lot of stigma attached to depression. So we all need to stand together to help each other and talk about that depression is a treatable condition which can be treated, and it's not a person's own personality or character flaw. It is some brain change, as Dr. Kalyan Sundaram was talking about. It's the same neurochemical changes which occur in other diseases. That's what occurs in depression. And those who are interested in seeking help, we do not have. I just want to emphasize that Indian Psychiatric Society has started free teleconsultations where 700 psychiatrists are providing free psychiatric services. So anybody can go to the Indian Psychiatric website, seek a person who is close to you, wherever you are staying or whomever you want to contact, and maybe you'll be able to get that help. And management of depression just involves taking antidepressant for a few months or seeking psychological intervention or both. So what I will just like to emphasize, stay safe, stay healthy, and stay connected. Namaste.